Good morning, and thank you to Providence Healthcare, the Research Institute, and the Foundation for this opportunity to speak today. As a family doctor, I have a privileged view of aging in all its forms on a daily basis, multiple times a day. And so I thought I would start by sharing with you 4 patients. So Judy lives alone in a second-floor apartment with no elevator. She is really healthy and well and has never been on a medication in her entire life. She does all her own shopping, cooking, and cleaning, and she belongs to a gardening club. Every day, she does one of her 3 Bs: badminton, bridge, or biokinetics, which is what she calls her exercise class. Anthea still works part-time as a physiotherapist. Her husband is 15 years older than she, and he has some health concerns. Anthea has severe arthritis of her left hip, and she's unable even to do her passion, which is bike riding. She needs a hip replacement. Victor lives with his wife in co-op housing. They have no children. He proudly states that he is an ex-nudist. The very first time I met him, 20 years ago, he was stark naked in the middle of the exam room saying, "Hi, doc." He has severe COPD, which has resulted in some hospital admissions. He has hypertension, osteoporosis, and prostate cancer. Kathleen was moved to assisted living 6 months ago after sudden cognitive decline, likely from a series of strokes. She has new onset heart failure, probably with her atrial fibrillation, and is rapidly becoming more frail and disabled. So unlike the hydra, a genus of small freshwater animals that have this amazing ability to regenerate themselves and thereby avoid old age and mortality, you, me, and my 4 patients are all in the process of becoming older. And as is so delightfully put in this Wikipedia, quote, "After a period of near perfect renewal, which goes to about 20 or 30 years of age, aging is characterized by the declining ability to respond to stress, increasing homeostatic imbalance, and the increased risk of disease. And this currently irreversible series of changes inevitably leads to death." So the Department of Family and Community Medicine believes that Providence Healthcare is ideally situated to develop a center for seniors care and healthy aging that will lead the world in innovation, knowledge creation, and knowledge translation, and in healthcare delivery by focusing on the reality of the human experience and its application to health science. So let us ask our patients why. Let's ask them what healthy aging is about. For Judy, healthy aging is rooted in her social interactions, in being active, in her brain health, in being able to drive herself and all her buddies around town, in being independent. She would also like to know that she could stay in her own home. Anthea belongs to the population group that is getting better. Healthy aging for her is about timely access to the treatment that she needs. She also wants to know what are the risks for getting arthritis in her other joints. Is there something that she could do to prevent that? And then she too wants to be able to move forward and focus on staying healthy. For Victor, healthy aging is about avoiding decline. He wants to know that he is on the right medications that are evidence-based for his age and his disease complexity. He wants to know whether there are new technologies that can improve his quality of life. He really wants care providers who are part of a team, who are sharing information, and who are focused on his whole being, not the individual parts of his body. And he too wants to stay at home. Kathleen wants quality at the end of her life. She wants to eat her salted cashews while she plays cards with her friends, and she wants to avoid unnecessary investigations and treatments. She wants skilled care providers to support her at the end of her life. So healthy aging is quality of life, and the goals of care conversations that enable it. It is about the environment, brain health, and physical ability. Healthy aging is about prevention of disease and management of chronic diseases. It is about how we deliver health care. It is about a good end of life. So where does this lead us? What are our, yours and my, next steps? I believe that we take the strengths that already exist in primary care across Providence and other organizations, and we then look and find for opportunities to collaborate. There are research and clinical experts here at Providence, some of whom will be presenting after me. There are experts at UBC in brain health, and various other amazing things. There are experts at Vancouver Coastal, Simon Fraser, who are already doing highly specialized work in some of these areas. And then there are the enormous opportunities with our community, innovation, and technology partners. I look at the Google driverless car in a totally different way nowadays. It's not about young people who are too lazy to drive, it's about our seniors. I think about data collaboration and collection. I think about city community centers and the knowledge translation that can happen there, our malls, and all these opportunities we have to really do things differently. So the gap that we have identified results in our living lab with very clear outcomes of what we want to achieve to prove success. So we would have a healthy aging living lab that takes the reality of human experience and applies it to health science, that is a hub of innovation and knowledge translation, that has a proactive approach to the needs of seniors and healthy aging, and as a result, we will achieve the triple aim to improve the patient experience of care, decrease the cost of care, and improve the health of this population. And we need you to work with us to achieve it. So I will leave you with these wise words, not from Wikipedia, but somebody way more eminent, that the chance to shape one's story is essential to sustaining meaning in life, that we have the opportunity to refashion our institutions, our culture, and our conversations in ways that transform the possibilities for the last chapters of everyone's lives. Thank you.